The following discussion will determine whether an EEA is justified in this situation and whether Odessa's current status as a minor provides her with the rights to refuse transportation to a medical facility. An EEA authorises the temporary detention and transport of a person to a treatment or care place in circumstances where the person is acting in a manner that indicates there's a major disturbance in the person's mental capacity. The criteria for QAS to consider when using an EEA is when a person's behaviour indicates they are at immediate risk of serious harm, where the risk appears to be the result of a major disturbance in the person's mental capacity caused by illness, disability, injury, intoxication or other reason, and the person appears to require urgent examination, treatment or care. The person can be detained and transported without consent to a treatment or care place. From Ezra's perspective, Odessa's condition had improved post his intervention and he was aware that she was not compliant with her medication schedule prior to the accident. However, nil assessment of neurological compromise was documented. It is assumed that Odessa's young age and inability to correctly self-medicate is what prompted Ezra to consider initiating an EEA protocol so further assessment and education could be implemented at a hospital. However, Odessa's behaviour did not meet the criteria for implementing this authority as she had no evidence of a mental illness or major disturbance in her mental capacity, and therefore the EEA was wrongly applied. Mental illness is legally defined as a condition characterised by a clinically significant disturbance of thought, mood, perception or memory. A decision that a person has a mental illness must be made in accordance with an internationally accepted medical standard. The QAS follows a mental status/assessment guide which justifies and determines an individual's mental state, which should be performed before issuing an EEA on a patient. To clarify, no documentation was provided that outlined a mental status assessment was completed prior to escalating to an EEA. Therefore, Ezra did not accurately assess Odessa's mental state, he just assumed she was mentally ill. According to the Mental Health Act 2016, there are numerous exemptions to a person's mental health, which includes if the person holds or refuses to hold specific beliefs or opinions, as well as if they choose to partake in specific activity. Odessa had a different opinion to the treating paramedic in her healthcare options and did not believe she needed the further care and transport to hospital. This conflict of interest does not justify Odessa for having a mental illness. At the time of treatment and the time of refusal, Odessa was not presenting with any symptoms and nil irregularities were reported describing her cognitive state, so it can be assumed that she was sound of mind. Therefore, there was no justification for the deprivation of her liberty. In order to understand if Odessa has the capacity to refuse transport, the term capacity must be understood in its relation with mental health. Capacity is a person's ability to understand the nature and effect of decisions, freely and voluntarily make decisions, and communicate those decisions in some way. Odessa does not have any defined mental illness that impacts her mental capacity, as type 2 diabetes is not a mental illness. Therefore, she has the capacity to make her own decisions about her healthcare. As per the QAS clinical practice guidelines, the capacity to make a decision is not a fixed state, instead is a fluid concept, meaning the concept can shift in response to a number of variables. The fluctuations are attributable to the patient's clinical condition or the effects of substances such as alcohol, prescribed drugs and/or illicit drugs. As capacity is a transient state in Odessa's case, this meant that when the first crew arrived, her capacity to refuse was diminished due to her clinical presentation, but after treatment, her mental capacity was restored, meaning she was able to refuse transport. Impaired mental capacity presents with disturbances in mood, thought, perception and memory. In Odessa's case, she did not present with any of these. In saying this, she did have blurred vision at the time of the crash as a result of her type 2 diabetes mellitus, which is a medical and not mental issue. She would need a medical professional such as a psychologist to determine if she had a mental illness. As per the QAS CPG, when attending a patient who refuses treatment and transport, the paramedic is required to conduct an assessment of the validity of that decision. The assessment is known as the VRCA and is based on the following elements: voluntary, informed, relevant, capacity and advice. This model can be used to determine whether Odessa's decision to refuse transport is valid. Odessa was informed of the risks towards her health when she made the choice to refuse further assistance. She was aware that if she refused further assessment and treatment at a hospital and remained on scene, her blood glucose level could drop below parameters and could cause a life-threatening injury. Treatment options and assistance might not be available or present to help her at the time if she was to lose consciousness. Odessa has the capacity and capability to understand the nature and purpose of the proposed treatment and the consequences and risks associated with her decision. Odessa is a minor, however she is sufficiently intelligent and has the maturity to understand the nature and consequences of the decisions. Therefore, she has the capacity to refuse. The paramedics must be aware that not consenting to treatment does not necessarily imply a lack of capacity. Odessa has the capacity to make a decision about transport, but does not consent to it. Although this may not be in the paramedics' best interest, and despite the inherent risks, as Odessa demonstrated capacity, the transport criteria does not apply. Children and young persons under the age of 18 years are able to consent to healthcare where they have sufficient capacity to do so. A child or young person under the age of 18 does not have the capacity to consent. Consent is obtained from a parent or other person with parental responsibility. However, in some situations, children can have the legal capacity to act on their own behalf. If they are able to understand the significance of what they are doing, they may be able to make a binding contract for the necessities of life, or they can make decisions about their own medical treatment. The test which is used to determine if a young person is capable of understanding is called the Gillick test. This encompasses the age of the person, the maturity and emotional development, the intellect, their physical and emotional condition, and their social circumstances. Odessa is 10 days away from being 18, and an adult in legal definition. She understands the significance of her health condition and the risk factors that could occur if she refuses transport. Therefore, she has the capacity to act on her own behalf.